Good afternoon. First, I want to remind everyone to fill out the U.S. Census form online or by sending back the form you received by mail. The funds we receive from state and federal government are based largely on population count, so it is important that each of us get counted. You can do this online in 5 minutes by visiting my2020census.gov. Second, I want to give you a brief update on how the village has been handling this health issue from an employee perspective. First and foremost, we want to ensure that our employees are safe. Those employees that can telework are doing so. Others are working half-time in the office and half-time at home. A few employees work in the office every day. The approach we have taken has our offices with far less than half of its normal employees in the office on a given day. Also, our police have adjusted their approach to limit contact with people when possible and are wearing PPE for all encounters. Our field staff has been working in 3-day, 12-hour shifts so that we have one person per truck, and the trucks are disinfected between shift changeovers, which happen every 3 days. Second, we believe that since our taxpayers are paying our employees' wages, wherever possible, we need to make sure they are earning that pay. In some instances, we have moved employees to help with essential tasks to ensure that those tasks are accomplished and to keep people gainfully employed and earning their salaries. Lastly, anyone who does not feel comfortable working and is considered non-critical can take paid time off or an unpaid excused absence. 6 of the 7 board members agree that these measures are the best way to ensure the needs of all stakeholders are met. The village has taken the approach of trying to solve the problems that have been identified, provided we have the capacity to solve them. A good example is the Masks for Medical program. A medical office made me aware of the problems they are having in getting masks. The Illinois Department of Health and Cook County Department of Health have not been particularly helpful, and rather than deal with the red tape, we sourced several thousand masks and simply asked the businesses to cover our costs. The village was well prepared, and rather than rely on the county and state that have been overwhelmed, we have focused on helping ourselves, our businesses, and our residents. Our approach has been, and will continue to be, solution and results oriented. I also want to give everyone a short update as the University of Washington model has been updated once again. It now projects about 1,200 deaths in Illinois, 1/3 of what it projected just 2 weeks ago, or just 1 week ago. It also indicates that Illinois has already peaked in terms of the amount of resources needed. If you look at the number of cases by onset date, the peak number of cases was around March 18th. It is important to look at the onset date because of how long it takes to identify a person needing to be tested and the time it takes to report a positive result. This information is great news. Here are some other important facts. In Illinois, 83% of total deaths are people over 60, and 95% of all deaths have some underlying condition. In Illinois, there has been 1 death under age 20, none in suburban Cook County. In Illinois, the death rate of existing cases is 18.4% for people over 80, 10.6% for people 70 to 80, 4.5% for people 60 to 70, and it drops significantly from there to near 0 for those under 30. In Orland Park, there are no cases for those under age 20. In the entire U.S., according to the CDC, through April 11th, there has been 1 COVID death from people aged 1 to 4 years, and 1 from age 5 to 14, and 7 from age 15 to 24. This is in the entire country. 91% of coronavirus deaths are from age 55 and up. This year, there have only been 84% of the expected deaths from all causes, which is based on the averages of the last 3 years. That's 101,000 less deaths than were expected. COVID deaths represent only 1.3% of all deaths at this time. We can expect that to increase to around 3% over the next few weeks. In summary, we know and have known for some time that people over 60 and those with underlying conditions are most at risk, and that those under 30 are at a very, very low risk. The facts are that even with COVID, far fewer people have died so far this year in the U.S. than died in the last 3 years up to this date. These are important facts that we need to keep in mind as we move forward toward a recovery. If you remember my first update, I said that the CDC looks at 4 things: morbidity, controlling the spread, impact on the healthcare system, and the economic impact. I also said that the CDC made clear that they were already focusing on the trade-offs for the last 2, because this was going to be a pandemic and there are no known treatments. Flattening the curve was not about less cases, it was about spreading them out to keep the hospital system from being overwhelmed. The good news is that this appears to have worked. However, there has been a tremendous cost, as it has crushed our economy. Since the beginning of the crisis, there have been people saying we didn't do enough and people saying that we've done too much. At the end of the day, there will be studies done using all of the data available to determine what we have done right and what we have done wrong. Some states and countries have been more aggressive than others, and we will, at some point, be able to see those results. I think history will find that some of our actions were appropriate and some of our actions were not. Typically, measured approaches to our problems provide better solutions than extreme approaches. I have also heard from our businesses. They have told me that they may not survive much longer. Orland Park has already had a couple of businesses close. They are also concerned about being able to provide for their employees. I have heard the governor speak recently about how we need to put more resources towards processing unemployment claims. An alternative way to solve this problem would be to start proactively opening some of our businesses to reduce the amount of unemployment claims. I agree with many of my fellow mayors that our approach to reopening should be regional, and the governor should engage with us to develop a plan for this reopening. This is why I reached out, along with a couple of neighboring mayors, to the governor and asked him to reconsider reopening some of our businesses at this time. We need to adjust our approach as we get more information, and we have a lot more information now than we had a month ago. Given that, I think some of our businesses can reasonably be reopened, and I asked the governor to consider doing so. Our grocery stores, warehouse stores, and large hardware stores are seeing upwards of 2,000 to 3,000 customers per day and have been able to figure out ways to enact social distancing with that volume of customers. We should at this time be able to open stores that see fewer customers and still provide important goods. Craft stores would be a good example. Additionally, we are providing large stores like Walmart, Target, Costco, Lowe's, and Home Depot a significant competitive advantage over their smaller and often local competitors that don't sell a broad enough line of goods to be considered an essential business. Things like flower stores, appliance stores, landscape nurseries, shoe stores, etc. should be able to be open provided they take appropriate social distancing measures. Additionally, outdoor locations like state parks, recreation areas, and golf courses can easily be opened while following social distance requirements. We need a measured approach to reopening, and we should start by opening our businesses that can easily accomplish social distancing. We will need to reopen our economy at some point. I hope this starts sooner rather than later. I also want to remind people that when things reopen, there will likely be an increase in cases. There will also be an outcry of, we shouldn't open the economy, we should leave everything closed. It doesn't matter when we open the economy, next week, next month, or next year, we will hear those same cries. However, the economy eventually needs to reopen because of the catastrophic ramifications of keeping it closed. We also need to get back to a more normal way of life. Going to concerts, the farmer's market, kids' baseball and soccer games are all important. This can be done in a safe manner if everyone is considerate of others. It is especially important that when we do reopen that people continue to practice good hygiene. It is also important that social distancing continues to be followed. If you are in an enclosed space, it is also a good idea to wear a face covering to help protect others. Most importantly, if you are not feeling well, do not go out in public and follow your physician's instructions. Remember, for those of you over 60 or who have underlying conditions, you are at much more risk. If you don't follow these recommendations when we reopen, it is quite likely that we could see things shut back down, which nobody wants. The residents of Orland Park have done a fantastic job of monitoring themselves and acting responsibly through these challenging times. I am confident that you will continue to do so as we begin to reopen our businesses. I will continue to advocate for businesses to reopen in a responsible and measured way. Based on the positive information we are seeing, the reopening of our economy is on the horizon, and like me, I am sure that you are looking forward to it. I am confident that America, Illinois, and Orland Park will get through this. In the meantime, please stay home and stay safe. Thank you.